Today we'll be talking about TAF data, reporting systems, and data structures. So what are we going to discuss today? Today we're going to discuss TAF creation and structure, how data structure can impact analysis and outcomes, and how to think about linking TAF files together. I tried to create this presentation so that a lot of the slides can kind of be printed out and used as references, so they are a little bit simplified, but feel free to ask questions as they arise. So let's start with TAF RIF, data source and processing. Why do we care about data source and processing? Understanding data source and structure provides helpful context when working with CMS Medicaid data. CMS ultimately doesn't collect data for the purpose of research. They collect data to successfully administer their programs. So by understanding upstream decision-making, we have a better chance of understanding how it impacts our analysis as we work downstream. So some examples I have here, it can help you with planning your analysis with TAF RIF, figuring out if assumptions that you're making are safer. Obviously, every assumption isn't 100% perfect. It can help explain anomalies in the data. So why are we seeing this? What is the definition of this? And it also helps provide places to look when you have questions. Here's sort of the general pipeline of how state Medicaid data gets transformed into TAF RIF, which is what researchers like you guys receive. So we start off with the state Medicaid data. That's what's collected by the states. T-MSIS is ultimately how states submit data to CMS. Then we have TAF, and we'll explain the differences between TAF and TAF RIF in a little bit. But we'll have TAF, which is the first process by CMS, and then TAF RIF again, which is what researchers receive. So let's go ahead and start with state Medicaid data. So state Medicaid data, just to summarize from what Nate said before, states have flexibility when designing their Medicaid programs. They're just working within broad federal guidelines. And why would states collect information? So I think first we can think about their processing claims to pay providers. This process can include managed care organizations. Nate covered that as well. They also collect data to prepare for submission to CMS via T-MSIS and potentially other reasons. The reasons that I put here are essentially to highlight that there are a lot of players and regulations that impact data collection, even if they don't trickle into the TAF RIF data that you guys receive as researchers. For example, federal financial participation does not trickle into TAF, but it is still information that states are collecting. And what does state Medicaid data look like? So as researchers, we may not know this for sure unless we are working with the state directly. We do have an idea that CMS sets data standards for T-MSIS, so we can at least have an idea of, okay, when states submit to T-MSIS, the data has to be in this type of format, and these are the rules that they have to follow. But anything outside of T-MSIS is a little bit of an unknown. Some states do offer aggregated Medicaid data sets, so that can provide some insight on what's gathered and why it's gathered. If you're searching for these aggregated data sets, I've found a lot of luck with adding PUF. So for those of you who aren't familiar with the acronym, it stands for Public Use File. Including transparency also has helped me sort of expand my search options, teach Google what I'm looking for, essentially. Now let's transition into T-MSIS. So before we talk about T-MSIS, before T-MSIS, there was MSIS. This was the source of Medicaid research data and still is the source if you have to work with max data. Some of the major differences between MSIS and T-MSIS is the number of data elements and the increase of automatic quality checks. So in MSIS, there were 400 data elements. In T-MSIS, there are 1,400. T-MSIS now combines Medicaid and CHIP data. And this last bullet point here is just kind of highlighting that states did not all transition from MSIS to T-MSIS at this time. At one time, they began in 2011 with all states completed with their transition in 2015. This will impact your data request process if you're looking at 2014, 2015 data, which is what we'll look at in a little bit. So what's the purpose of collecting data via T-MSIS? CMS wants data to conduct program oversight, administration, and integrity. They also create some data products directly from T-MSIS, so I have an example there. And T-MSIS also allows for the downstream research projects, so that's TAF and TAF RIF. So what is TMSIS collecting information on? This is a huge list, but essentially what they want to collect is who's in Medicaid, what are they utilizing? They want to collect information on managed care. So what does managed care utilization look like? They want to know who is providing care for Medicaid and general financial transactions. So that like things such as supplemental payments to providers and other payments. And what does TMSIS look like? So it's 8 distinct files that can be separated into these 3 general categories. I categorize these for my own thought process, and I thought it would help a little bit. If you have any experience with a TAF RIF, you'll notice it does look very similar to what you can receive via TAF RIF. The only exception here is that there is the third-party liability, which is under beneficiary information. This is a file that collects information on other forms of insurance or health benefits that a beneficiary may have. So this is Medicaid's way of sort of being like, who else can pay other than Medicare or Medicaid? This information is captured in the TAF DE file, and I'll remind you all about that in a little bit as well. So what does TMSIS data look like? So we talked a little bit about this first bullet point, but the links that I have here are really guides that CMS has created to help states submit in the proper TMS or TMSIS format. So I do want to mention that TMSIS is a complex living data set. So the way that TMSIS works is that information is stored based on when states submit data, and states submit data on a rolling basis. There are no identifiers for final action claims. It's a very complex relational database, and I sort of think of it as a kind of like a Cookie Monster. It just keeps eating and it keeps like growing. I guess Cookie Monster doesn't grow, but it just continues to accept data. So since all monthly submissions are retained, it just continues to get bigger and bigger. So CMS does report on data integrity by state. This is known as outcomes-based assessment. Essentially, CMS just wants to make sure that the data that they're collecting from the states meets their standards so that they can go ahead and, like I said previously, review program oversight and make sure that things are running as intended. If you click on that link, there aren't historic integrity reports. So when you click on it, you'll see what it is in the moment. I haven't been able to find a way to identify historic integrity reports. But in general, what they're looking for is similar to what I said they were collecting information on. They want to make sure that their beneficiary demographics and eligibility information makes sense, the expenditures and utilization makes sense, provider characteristics and managed care reporting. They just want to make sure all of that is reported in a way that makes sure that the data is usable for program oversight. So now let's go ahead and dig into TAF. So here's where I talk about the difference between TAF and TAF RIF. Normally in a ResDAC context, when we talk about TAF, we typically mean TAF RIF. The TAF isn't something that can actually be requested through the Research Identifiable File request process. This gets a little bit trickier as you guys look out and try to find information. Some sources may say TAF, some sources may say TAF RIF, so it'll be really important to take in the context to figure out whether or not a source is TAF or TAF RIF. So why does CMS transform TMSIS into TAF? And so they're still trying to conduct program oversight and decision-making and do some research. The main thing that the creation of TAF allows is that it balances the timeliness of data, so the most recent information available, and the completeness of data, so the stability of that data, so how wanting it to not be changing as frequently. The TAF is processed every month, and every 12 previous months of data are refreshed. So the examples here that I have here is if they produce a TAF file in March 2023, they refresh the months from January 2022 to February 2023, and they just keep doing that every month. So data cleaning and consolidation, specifically for enrollment and eligibility, I want to sort of point out that things that happen at this step, Things that happen at this step will not be found in the TMSIS documentation, especially anything like variables that are added. So sort of keeping in mind like, oh, when these things happen, this is when I look at TAF, if there is available TAF documentation rather than TMSIS documentation. So TAF enrollment data cleaning includes retaining the most recent information, they're reconciling conflicting information, they're recoding invalid values, they're combining monthly values, and then I've included some variables that they've added here. So remember that TMSIS retains all the information submitted by states on a monthly basis. So these are sort of used to consolidate all of that information into usable information. So we've got the monthly variables to track program enrollment and benefits throughout the year. They have the last best variable, which essentially they look at the most recent month of the calendar year with a valid value, and they use that. There are some variables such as sex or birth date that may be pulled from other years, but for the non-special variables, they'll just be put as null as last best. And then we also have the ever in year. So that's pretty straightforward. If a criteria has been met at any point of the year, you have like a yes, no indicator. So what about claims? How are claims cleaned from TMSIS to TAF? TAF will create monthly files based on dates of service. They have an algorithm that they use to create final action claims. The only exception to this is Illinois, which can have multiple rows for the same event. It has to do with Illinois' reporting system. So at this time, if you're working with Illinois, then you have to just be aware of that. There is a documentation on how to work with Illinois. I think I forgot to link it, but I will make sure to ask Steph to add it to the resources. From TMSIS to TAF, they also fully exclude denied and voided claims. The only exception to this is if a claim as a whole is approved and paid for, and maybe there are denied lines, then those denied lines are kept within that claim. And then last but not least, they transform invalid values to null unless the code list is not maintained by CMS. So things like zip code, diagnosis procedure codes, NDC, CMS does not check if they're invalid or out of range, and they do not transform them to null in those situations. So what does TAF look like? It looks similar to TAF RIF, and we're actually going to get into that a little bit. So I don't want to exactly say like, oh, this is exactly the differences between the two. We'll be going over that. Some of the important major differences is that it is refreshed on a monthly schedule. So I still consider it a living data set. And unique information that's available in TAF, typically personally identifiable information, PII, are in TAF data. So things like name, address, social security number, HIG, and MBI are included in here. So now we'll go into TAF RIF. And again, TAF RIF is what's available for researchers. It's really important to discuss the changes in Medicaid data formats over time. So we focus on TAF in this particular workshop, but anyone who's planning on using data prior to 2016 will also need to take time to familiarize themselves with MAX and MAX-T. So in the beginning, at first we had MAX. So MAX was essentially a MAX file format, and it's sourced from MSIS. Remember, that's the older version before TMSIS. And then we have MAX-T, which is still the MAX file format, but it's sourced from the TMSIS files at that point. And then finally, we have what we can work with now, which is TAF RIF, and that's the TAF RIF file format sourced from the TAF monthly files. Here's a huge table. Don't get too overwhelmed. It's a little bit of a preview. This is the TAF Max availability matrix. The full table is available on the ResDAC website. Essentially, what this table tells you is when did states transition from Max to TAF, and how does that translate into the data that you should receive? So for example, if we look at Arizona, the third row down, you'll see that they are MAX-T for 2014 and then TAF from 2015 onwards. So let's say you are interested in Arizona data back to 2014, you will have to request MAX data for 2014 because there will not be TAF Arizona data in 2014, if that makes sense. So this table is really useful if you're working with 2014 or 2015 to figure out, do I need MAX and TAF, or do I just need TAF? So why does CMS transform TAF RIF from TAF? And the main reason is that it allows external researchers to analyze the Medicaid program, so Medicaid and all CHIP. A little note I wanted to include here, MAX only contained Medicaid and M-CHIP, so TAF is an expansion on MAX as a whole. TAF RIF also has increased record maturity and data stability, essentially meaning that TAF RIF is released at a later date and there are fewer releases to them. So how is TAF RIF processed from TAF? And so instead of monthly files like in TAF, TAF RIF is created as an annual file based on dates of enrollment or service. So similar to MSIS, from MSIS to MAX, if you guys are familiar with that. And they are produced less frequently. So like I said before, TAF is a monthly data set. TAF RIF is released on an annual basis, preliminary and release 1, which I'll talk about in a little bit. So in terms of record maturities, there are two common runoff periods available for TAF RIF. There's the preliminary file, which has 6 months of runout, and then there's release 1, which has 12 months of runout. There is the potential to have more releases. It's a little harder to predict if an additional release will be provided, but I do just want to say that here so that you guys aren't surprised if there's like a release 2. This is different from MAX, which is typically 9 months. So on the percentages that you see here, so under, preliminary file, you see it says fee for service use 97%. This is based off of MACBIS analysis. Essentially what it describes is the completeness of the claim, assuming that claims are complete 24 months after their maturity. So here it'll say, so essentially how you can interpret this is that at 6 months, 97% of the service use claims for fee for service were present, whereas in 12 months of runout, 99% of those claims were present. And then still talking more about processing, things that were changed, identifiers, the PII were removed, Medicaid identification numbers were encrypted, both MSIS ID and MSIS state number, or MSIS case number, excuse me. And there was a CCW Benny assigned, and that is to help you identify a single beneficiary. There are also new TAF RIF element data elements that were added. So the Benny ID, as I mentioned before, the state code, which translates the submitting state code into the alphabetic postal abbreviation. And there's also a CCW load date included. From TAF to TAF RIF processing, there's also some removal of unreliable data elements, such as the pregnancy flag. If you want a full list of updated variables, I have a link below. Appendix tables 5 through 8 sort of go through in very great detail what changed and exactly what changed. And then continuing on processing, in order to retain consistency across CMS datasets, so if you're familiar working with Medicare, it's not as jarring to try and start in TAF. They renamed some of those data elements to be consistent with others, and they essentially rewrote any load date values and removed trailing whitespace and non-keyboard characters, essentially items to help you with consistency while you're coding. Some of you have asked about managed care payments. So in TAF, managed care utilization is included. The thing that we warn about is that since utilization is present, but payment is not, and the list of payment variables not included are here. The only exception is that if the payment field is considered non-managed care, then it will be available in a managed care claim. So these are things like third-party liability and Medicare payments. So only if those are applicable to the claim. And then last thing I want to share is for 2014 to 2016 data, release 1 and release 2, and 2017 to 2018 release 1. These types of items are not found in the data. So service tracking claims, if there are items with claim type, missing claim type code, missing MSIS IDs, and bulk payments, those are not available for those data sets. However, from 2017-2018 release 2, which I believe is the release that is available now onwards, these exclusions aren't applied. So you can actually request that type of information if you are interested, example with service tracking claims. Now we're going to go over the TAF RIF data file structure. So this will look familiar, but this is specific to the TAF RIF file types. Again, we have 8 file segments, but we don't have the third-party liability file. That's because that information is captured in TAF Demographic and Eligibility, or TAF DE. We also have the introduction of the Medicaid and Enrollee Supplemental File National Death Index, or MESF NDI. This contains death dates verified by the National Death Index. So before we go in too deep with the TAF RIF files, I just want to briefly talk about the identifiers that are available in TAF. This will give some context when I'm saying things like a single row means this identifier and this identifier. So for Benny ID, this typically applies to one person and remains constant over time. And for MSIS ID, this ID is unique in the sense that the same individual could have multiple MSIS IDs, both within and across states. And this MSIS ID has to be used with the submitting state code. So let's go ahead and start with the demographic and eligibility file. So this is sort of like one big summary. I'm not going to try and read it all out to you, but the TAF annual demographic and eligibility file, this is your demographic file. It includes anyone who is eligible for Medicaid and CHIP during the calendar year. Beneficiaries who have claims data but no eligibility data are present in this file as well. This is known as dummy records. We will go into the segment details, but in general, this file, you can think about it as demographic characteristics. It's got date of death information, and it's got really detailed eligibility information. So let's start with the TAF DE base segment. You'll notice here, I just want to prep y'all, the first bullet point is typically what each row in a file represents to help analysts who are new to the TAF data. The reason I sort of want to point this out is, as someone who started analyzing TAF, I would assume something like, oh, I can use MSIS and state code, or I can use Benny ID, and then be surprised when I see them multiple times in my data and then end up, double counting or things like that. So a single row in TAF DE base is a MSIS ID and submitting state code. And then to add to that, submitting state code is different from state code. So one state code can actually map to multiple submitting state codes. This has to do with how states submit T-MSIS data. So if there are different entities submitting to T-MSIS, sometimes they receive their own submitting state code. So actually on the base segment is most likely the segment you'll be working with the most. It's the segment that contains your summarized information on demographic and eligibility variables. Some variables of interest include enrollment, eligibility, and plan information. This file is also very useful because it has flags for any of the other supplemental segment records. So if you want to know, for example, does this beneficiary have any records in the managed care enrollment segment? This is the segment you go to, so you don't have to do it on your own. I'm sorry, I skipped 2. So let's start with the date file. For the date file, each row represents an enrollment spell per MSIS ID and submitting state code. So I just want to point out here, in this circumstance, if a beneficiary has multiple enrollment spells, you should anticipate seeing multiple rows for that beneficiary in this file. This file also includes helpful information such as enrollment start date and end date. This is different from the base file, which kind of gives you a monthly indicator of how many days in this month did the beneficiary have enrollment. This file you can also use to identify enrollment type. So for the managed care enrollment file, there is a single row for each MSIS ID and submitting state code combination that was enrolled in a managed care plan during the year. This is the file that contains the detailed information on beneficiaries and their managed care enrollment. There is a lot of space for states to report managed care plans on a monthly basis. So you can see up to 16 plans, and each plan gets 12, so for each month, 12 variables for their plan ID and plan type code. So in addition to these really detailed information, they do have summary metrics such as number of months enrolled at each plan type. And then I have a little list here of some of the plans that you can anticipate finding information on in the managed care enrollment file. So for those of you who are interested in waivers, there is a waiver plan program enrollment segment as well. So this is a single row for each combination that was enrolled in a waiver plan during the year. Again, similar to managed care, there is a lot of room for states to report on waivers. So they can report up to 10 waivers, and similarly to the managed care enrollment, each waiver that can be reported can report the waiver type code and the waiver ID for a total of 240 variables. There are also monthly indicators for the various waiver types and summary variables for the number of waiver months available. There's also a segment called Money Follows the Person. This file is specific to that program. It's a federal grant program that was designed to transition long-term care residents into a community setting. So for this file, it's a single row for each MSIS ID and submitting state code combination that was enrolled in this plan during the year. In this particular file, you can see a monthly indicator of participation, as well as the type of qualifying institution and residence for this program. For those of you who are interested in health, home, and state plan options, this is also a segment in the TAF DE. It is a single row for each MSIS ID and submitting state code combination that participated in a health home, enrolled in a state plan option, or had a health home chronic condition. So there are monthly indicators for health home enrollment and state plan options. And then finally, there is the disability and needs segment. I think this file is a little bit of a catch-all, so don't let the name fool you. So it does have information on disability and needs, such as government assistant programs, but it actually also includes the information on third-party liability in here, which I thought kind of snuck in a little bit. There are also monthly indicators for disabling conditions. These are reported by the state, and HCBS chronic condition indicators. Now we'll dig in a little bit into the MESF NDI. So this file contains death information on beneficiaries. I do want to say that it's unique from the TAF DE, which also contains death data. The NDI file is sourced from death certificates. It's a data set that's managed by CDC, and it includes cause of death. Note that this file isn't on the same update timelines as TAF, DE, and claims. It's actually updated sporadically, and so at this point in time, it's available up to 2020. So the MESF NDI is created a little bit uniquely. What happens is that CMS will request data on beneficiaries with death dates, so they'll request both Medicare and Medicaid at the same time. CDC will pull the National Death Index data on that beneficiary list. And in order to be included in the MESF NDI, they either, one, have to have a date of death in Medicare and any Medicaid enrollment. So this requires that the beneficiary is a dual in the sense that they are found in both Medicare and Medicaid data. And in this sense, Beni ID is required because otherwise there would be no linking between the two. Or the beneficiary had a date of death in Medicaid. I do want to put a little note in here for those of you who plan on working in the MESF NDI or who have been working in this file. It is possible to observe a Beni ID or MSIS ID submitting state code in the MESF NDI that has no enrollment in the TAF DE for that year. Normally what that means is that the beneficiary was enrolled at some point in prior years. And here's a little summary about the TAF claims files and what you can find in them. We'll go into more detail about this, but I wanted to sort of create this for you guys to have an easy sort of glance at what is included in each file. So we're going to start with the TAF inpatient. It contains 3 segments, and we'll discuss the definitions of each segment after all of the TAF segments. This is the file that includes hospital stay records. So stays can actually be associated with more than one claim or one row. Data highlights include diagnosis codes, procedure codes. Note that there is a DRG present, but it's actually not required by CMS, and it could be a state-specific code. So if any of you are interested in DRG, I'd say watch out for that. We also have the long-term care file. So this file contains 3 segments as well. This is your information on institutional long-term care beneficiaries, such as nursing services. It includes diagnosis codes and coverage day counts at the facility type level. We also have the TAF pharmacy. So this one actually only has 2 segments. This is the file that includes pharmacy events and prescription drug fills, unless they're provided during a hospitalization. When working with the NDC, I just want to mention that the NDC is included, but the drug name and taxonomy are not. So you'll need to have some type of external NDC database, either through NDC, or some states do offer drug searches by NDC if you wanted that type of information. And then last but not least, we have the TAF other services in terms of TAF claims. So this one also has 3 segments. This file is essentially anything that's not inpatient, not long-term care, and not pharmacy, all go into this file. So it's actually a mix of institutional and non-institutional claims, which can be a little bit difficult from a coding standpoint. From 2021 onwards, there is a variable called the federally assigned service categories that helps you parse through these file types. But for earlier years, you'll need to construct your own or create your own definitions. So you'll notice here that there are diagnosis and procedure codes. But again, one thing I do want to know is that you have to be conscientious about, am I looking at institutional or am I looking at non-institutional claims, so that you can make sure that you capture everything that you're looking for. So now I want to talk about the segments that I've sort of glossed over. In very basic terms, the header file is your summary file. There's 1 row per record. This is your summary information all over overall. And if you're working in TAF inpatient, this is where you'll find your procedure information. The line file is your detail file. So it'll be 1 row per revenue center or ambulatory procedure. This is the detailed information. So you'll find if you're working in TAF long-term care or other services, your procedures will be here, and it will say per procedure, this is how much was covered, so on and so forth. And then last but not least, there's the occurrence file. This file describes events related to a claim, so it can actually explain if there is non-standard payment, why there is that non-standard payment. The only thing about this file is that it's not available for the pharmacy file. And now we can talk about the provider and plan information. So if you haven't already been able to sort of figure it out, there is a lot of information in TAF. So when we look at TAF annual provider, this is, I know you see 9 segments and you might be sweating like, oh no, Sammy's gonna go through each segment. For the provider and the plan, I will just sort of glaze over them a little bit. But the annual provider file is the file that contains information on Medicaid providers. So this can include group practices, individual providers, and facilities. There's demographic information on the providers, name, entity type, taxonomy, location. You can also find information on who they're affiliated with. And if they're a facility, you can get information on bed types and bed counts. And then the TAF annual plan file. So this is the data set that contains information on both plans and managed care plan entities. So it's not just on the plan. You can get information such as service location and geographic service areas and what type of enrollees can be enrolled in each plan. For those of you interested in waivers, there is waiver information as well. It's sort of tucked into the operating authority segment. All right, so we did the TAF data file structures. Now let's talk about how it can apply to your data analysis. So just a brief summary, everything that we just went through, the demographic and eligibility, claims utilization, and then plan and provider information. So a little summary about things that I'm going to talk about today, sort of thinking about at what levels are we thinking about Medicaid analysis, and do those levels make sense? And how can data file structure impact if we want to look at utilization? So we'll go into more detail in program and data reporting at a state level, but we're just going to do a brief overview here. In general, at ResDAC, we don't recommend making conclusions at a national level because state variation is really high, not just in their program implementation, but in data quality and reporting. And even then, Medicaid within a single state is not monolithic, so different groups can have different benefits. Implementation may differ on a county scale depending on resources available. So it's really important to think about who or what is being overwritten when we summarize data. And now thinking about applying data file structure and knowledge to analysis on data utilization. So the two things I'm sort of looking at here are, one, how can data file structure impact what data files I need to request, and how can data submission impact what's important to me and my study? So for that first one, what data files to request, I have an example here. So let's say we're interested in looking at birthing parent, right? So intuitively, we might think like, yeah, we definitely want the denominator file because we're interested in demographics, and we want the inpatient file because we want to capture the birth. But depending on how your study is set up, you may also be interested in the other services file if you want to know their physician services before and after, if applicable, right? So it depends on what your study is looking for. And then how data submission can impact what information is available to me. One way we sort of think about it here at ResDAC is, what are the billing rules for the providers? So for example, hospitals, we normally think about ICD diagnosis and procedure codes, but if you're thinking about things on a physician level, so claims that you might find in the TAF other services, you might have to look for things in CPT, HCPCS codes, and ICD diagnosis codes. And then just sort of a reminder that claims data is a little bit of the tip of the iceberg. We know what we know, and we don't know what we don't know. So Medicaid claims data will include information of record of care received and paid for by the Medicaid program. So anyone who goes undiagnosed, anyone who loses services because they are no longer enrolled in Medicaid, those people, we won't have information on them in claims data. And just because of services weren't used doesn't mean that, or just because service use isn't present in the claims doesn't necessarily mean that the services weren't used. Ultimately, when we work in TAF, we do see a record of care received, but not necessarily what care is needed. So disease recurrence rates can be difficult to assess because we generally only see what's actually treated. So a couple of things to look out for is lack of access and high volume of treatment are both potential sources of error here. All right, last segment. You guys are almost there. So let's talk about linking TAF data. I really want this segment to sort of provide the groundwork for those of you who have to be in the data and follow people. So I'm hoping that this segment will give you the tools to create your own planning map. Here's a general overview of how to track different entities using TAF files. So we have following a person, a facility or provider, following a claim, and following a managed care plan. And we'll go into more details about this in the next few slides. So you guys have probably heard this a bunch of times already. Like, Sammy, how many times are you going to talk about the Benny ID and the MSIS ID? And to that I say a lot, I promise. These are the identifiers to follow beneficiaries. To recap, the Benny ID identifies a single person, but it can appear multiple times in the TAF DE because if a beneficiary moves or they change enrollment, sometimes they're assigned a new MSIS ID. So for those of you who are like, oh, Benny ID appears multiple times, it's not because it's for different people. It is still the same person, but that person is moving a lot. Not a lot, I shouldn't say, but that person is moving around in Medicaid and being assigned a new MSIS ID. So and another thing that's really nice about the Benny ID is that you can use it with other CMS data. So if Benny ID 123 is in Medicare and it's also 123 Medicaid, that's the same Benny ID. So talking about MSIS, as I said before, one person can have multiple. The baseline, so the non-repeating version of this identifier is MSIS ID and submitting state code. But if you plan on rolling it up to the Benny ID or you plan on using the state code rather than the submitting state code, you'll need to figure out how you roll up information, and I'll talk about that in this next slide. Oh, actually, before that, you'll notice that there's a little table down here. This is me trying to summarize where you can find the identifiers that I'm talking about. So after each little section, you should see that table. So I talked about this really briefly, but sometimes you will encounter the same ID, but different MSIS ID combinations. This can also happen if you're working with MSIS ID and state code. In these situations, you'll have to determine how to handle these records as they can have conflicting information. So things you can do, you can overwrite them, you can retain one, retain both, remove blanks, choose certain things to prioritize. Ultimately, it's dependent on what you need, but I just want this at the back of your mind because it is something that you'll sort of bump up against. If you're interested in following a facility or provider, there are a couple of identifiers. The first two are a little bit niche. There's the APR link key. This is specific to the TAF APR. It's actually just a replacement for submitting state provider ID and submitting state code. CCW created this to make your coding life a little bit easier, especially if you're only working in the TAF APR. Then there's also the provider location code or ID. So it's called location code in the TAF claims, but it's called ID in the TAF provider file. This has to be used in conjunction with the state assigned provider ID. It's used to distinguish between different locations associated with the same provider. This code is not available in all TAF APR segments. It's available in location, license, identifiers, and bed type files. And when you're linking to TAF APR or TAF claims, excuse me, for TAF inpatient, other services, and long-term care, this code refers to the servicing provider ID. If you're working in TAF pharmacy, it refers to the dispensing provider ID. One potential point of discrepancy is that when you are working in the TAF claims, there's only one place to put a location code in the header file, but you can find, especially in TAF inpatient, other services, and long-term care, you can find multiple servicing provider IDs. At this point, there's no way to confirm if the location code refers to all of the servicing providers, some of them, or just one of them, if multiple providers are present. And then ones you're probably more familiar with in terms of following a facility or provider is the NPI. That's your standard provider identifier. It can link to the NPES, which is, for those of you who may not be familiar, a file that contains information, demographic information on CMS providers. And then there's also the submitting state provider identification number or provider ID. This is a state-specific identifier and typically the one that is used in the TAF provider file to help you get around. In general, I do want to mention that when you work in TAF claims, the submitting state provider identification number typically doesn't say submitting state beforehand, like it does in the TAF provider file. Instead, you'll want to look for variables that have the PRVDR_ID, so provider ID suffix. And then following a claim. So in general, I recommend following a claim within the same claim type and claim year. So for example, if you are working in 2016 TAF inpatient header file and you want to link the claim, either link it to the 2016 TAF IP line file or occurrence file. In the very, very small possibility that a claim ID links from one file to another that you think it shouldn't, those are not related claims. It's just a it's a very lucky day, I guess. It's very unlikely that it would happen, but if it does, it doesn't mean that they're related. Linkage for claims may not be one-to-one, so one header claim ID can be associated with one line item, multiple line items, or in the case of the pharmacy file, no line items. And then identifying a managed care plan. So we've got two identifiers here. We've got the managed care plan identification number or plan ID. So that's your state-specific identifier. And then we also have the APO link key. So very similar to the APR link key, it's a unique variable only available within the TAF plan to sort of help you quickly navigate just if you're working just within that file. And then some caveats of linkage. When you are linking files together, just some things to talk about. We talk about this a lot already, the duplicate values, right? So some identifiers can appear more than once in a base segment. Variable quality and linkage, not all variables are created equal. So some variables will have more reliable fill than others. The one that always comes to mind is billing NPI is typically very reliable compared to other NPI fields because that's the provider that gets paid. And providers do want to get paid for what they do. And you'll also notice that you may have to use multiple variables for linkage, especially in TAF. So in general, although my summaries may say like you can use MSIS ID, I really mean like MSIS ID and submitting state code. And last but not least, linkage relationships. All linkages are not one-to-one, so just be careful when you are merging things together. Check your record count, make sure things make sense and things aren't, getting super bloated when they're not supposed to be, or maybe not merging as intended. So just watch out for that as well. All right, so the presentation as a whole is over, but I did want to share some summary slides that I've made, hopefully to help you guys reference in the future if you're working in the TAF data. It is very, high level, bare bones, but I'm hoping that it'll help a little bit. So the first one we have is the identifier summary table. It sort of summarizes all of those little tables that I shared with you guys, put that all together. So on the left-hand side, who are you trying to follow? And then or on the left-hand side, yes. And then at the very top, what files have those identifiers. And then last but not least, we have linking within TAF segments. So on the left-hand side, I described the file types and then the identifiers that you can use to link within each segment and a little bit of notes here and there so that you can keep your eyes out and be like, oh, okay, that's right. For Benny ID, there's not going to be one for every MSIS ID and submitting state code.